Welcome to the Medical Ancillary Sales Podcast, your number one source for making money in the medical ancillary sector. Mike and Viv bring you the latest information from lab services, pharmacy, diagnostic testing, and so much more. The latest in ancillary services will be right around the corner. Welcoming the hosts of the Medical Ancillary Sales Podcast, here's Mike and Viv.
Hello and welcome to the Medical Ancillary Sales Podcast. I'm your host, Michael Berg, and joined by Viv, still on location in the Down Under. How are you doing, Viv?
I'm good, thanks. All the blood's rushing to my head from being upside down for so long.
I tell you.
Oh dear.
So,
but,
Viv,
yeah.
I wanted to. I read this brilliant article recently that I thought we could discuss today. Now, in full disclosure, I wrote the article. So
I did see that.
So I did I wrote a recent blog on something that I was talking to someone who is a rep out in the field, and they were just kind of chit-chatting with me about trying to decide which things to carry, and which ancillaries to carry, and that got me to thinking. If you were just starting out right now, there are so many different ancillary services, and then in each sector that you get in, each of those could be subdivided a million ways, and in the aggregate, you got hundreds of choices of what you could go out there and sell. And so, as an independent medical sales rep, I mean, one of the advantages is you're a free agent; you can sell whatever you want, and with unlimited income potential. But the problem is sometimes these things just start coming at you faster than you can keep up with them. And there's just newer and newer programs, and each one looks shiny and each one looks great. So, Viv, I'm going to turn the tables on you first and ask you, how would you decide if you're going out there now, if you're just starting off your career or just starting off in a new territory, you're looking at the full slate of ancillary programs and all the sub-programs. What are you basing your decision off of?
Well, I think it probably comes down to a couple of different things. So the viability of the product for a start, does it have traction? And also, what is it that gets me out of bed? What am I going to be happy to sell? And I know that's what you touched on in your article is definitely just getting out there and being passionate about what you sell. Because at the end of the day, if you don't have your heart in your sales pitch or your sales philosophy and what you're trying to sell, you're never going to be as successful as something that you are passionate about. So I think definitely something that you see a belief that you think that it can really change people's lives or help them in a positive way, that's easy to sell. If you're just doing it for the money, that's you can only go so far before you run out of things to say.
That's the temptation, and I'm not immune to it either. Of course, you see the thing that's going to pay you out the most amount of money, and that's some people are going to gravitate to that automatically. But the problem is, just because something pays you the most amount of money on a per transaction basis, probably in the long run, you're going to find that you're not going to make as much money as if you stick with things that you know really well and that you're extremely passionate about, and things that you know deep down to your core that customer would be an idiot for not doing this. They need this thing. They got to have this thing. This solves a big problem that they have. And I know for me, and I mentioned this in the article, and this goes for John too. John Russ from Lab for Lab. That's the automatic first thing he and I both talk about, and probably you too, when we talk to toxicology labs. And now, granted, there are programs that we could be making more money on than bladder cancer screening, but bladder cancer screening, where it really clicked with me was when the pathologist called us and said, "Hey, I have cancer that I found in. I'm looking at a slide right now. This is a patient that has cancer." Well, this isn't a oncologist or urologist that sent this in. This was a pain management doctor who just was doing a routine screen because the patient hit the criteria. They were over the age of 40. And as we've discussed many times in this podcast, we know the reasons why it's important to screen. It's very prevalent. It spreads quickly. And if you don't catch it early, you better go start shopping for coffins. If you catch this thing at stage 4, you really don't have, you don't have a snowball's chance. So once I heard that, and the pathologist said, "Oh yeah, no, I'm looking at it right now. My next phone call is going to be to the doctor to let him know." And then, okay, well, what are you going to do then? Well, I assume that that doctor will then refer that patient to an oncologist or a urologist who can better treat him. Perfect, exactly what we wanted. But that got me to thinking, that patient, the doctor didn't indicate that that patient had any symptoms whatsoever, which is part of the reason you do the screening, is that a lot of these patients who are on pain medications, the pain medications also mask the symptoms. And then I was thinking, I don't want it to sound like we're Mother Teresa and Gandhi over here. But at the same point, I definitely slept a lot better that night thinking, geez, if we weren't promoting this to that doctor and let that doctor know that, hey, this is a problem. There are 70-some thousand new cases of bladder cancer a year. Your patients are at a higher risk, and you may want to consider screening them. It's covered by their insurance. And a lot of doctors will take you up on it, and they will do the routine screens. And lo and behold, we catch a patient. That patient, potentially, it's not hyperbole to say, we may have potentially saved that patient's life as a result of, you don't think of like sales as being a job where you could save lives. But honestly, had a salesperson not gone into that practice and taken that step to explain this to the doctor, that there was an important step in getting that patient treated. I don't know. Do you think I'm being exaggerating our importance a little bit, Vivian?
Well, I mean,
maybe a little.
But no, I mean, what you're saying is very true, because we all, at the end of the day, I think, when we sit there in our twilight years and reflect back on life, I mean, you really want to know that in some way that you've made a difference, that something that you've done in your life has made a difference. And I think that's just who we are as human beings, and that does help us to sleep well at night. And if you as a sales rep are out there changing people's lives because of what you sell, then you can sleep well at night. And hey, if you make money in the meantime, then that's what we all need anyway.
Yeah, this is not to say that everything we sell has to be a life-saving cancer drug or something. It could be helping a small business stay in business. That could be what motivates you. It could be helping a physician add some revenue where they're being threatened by the large hospital systems in the area. And if that's what motivates you, if you find that as your if you can find that thing that you really truly believe in, that's what comes through. And I think back to my past and the things I've sold. And going back even to my early days, before I was even out of college, I remember selling one thing that I really believed in. And I thought, God, this is the greatest thing ever. I sold the heck out of that thing because my enthusiasm for it and my belief in it really came through to the clients. And not only that, you're trying to build a long-term relationship. I mean, this is a relationship game, and this and these doctors can sense, just like anybody else can sense, when somebody is being genuine, and building that long-term relationship. I think it behooves you, and you'll be much further along if you can speak with passion about something, and they can sense that on you. I'm kind of talking in circles here, Viv, save me.
Yeah. But no, I mean, the other thing is, like, if you're an allergy sufferer or you've lived with an allergy sufferer, seeing how the allergy program can benefit people. I mean, there's how many people are in the US that suffer from allergies? Was it 70 or 80 million? Or
it's like a quarter of the population.
Yeah. So if you can help some of those people so that they're not going to work each day with a Kleenex stuffed up each nostril and a packet of hay fever tablets in their bag, and and wishing that they could just curl up in a ball, because I mean, I've seen that. I mean, my mum was a shocking allergy sufferer, and she just used to have to go to bed with it, and it just made her so miserable. And, you know, you look at the mental health program, you know, if you can screen somebody and help avoid, you know, a suicide or something else happening because of that, then that's worthwhile. So there's plenty of programs out there that have a feel-good factor, but as you say, talking about the helping a small business stay in business, that's what I can get very passionate about, because having been in small business myself and as a professional, you know, it's not always as rosy as everybody thinks that it is. And you know, we never sit around the dinner table and talk about our tough times with our family and friends. I mean, we only put the happy things on Facebook and that. And we don't know how much people are really suffering. And if you can walk in there with something that's potentially going to save a business, you're not just talking about that doctor being able to put food on their table and, you know, pay off their kids' education or whatever. I mean, you're also talking about the people that work for that doctor's office, you know, keeping them in jobs and feeding their retirement or whatever. So, you know,
Absolutely.
it's
and just, to touch on something you mentioned earlier, like with your mom, I think that really, like I had mentioned the example with bladder cancer with me. It was when bladder cancer, it's, you know, I believed in it as soon as I heard about it. I thought, well, this, you know, I could see some use for this. But it wasn't until I had some personal experience with it. Now, I don't know anyone with bladder cancer. I haven't been personally affected by it. But that would be even more effective if I did have a personal experience with it. But even just having the personal experience of really made it real to me that, oh, wait a second, here's a real patient that really got a benefit from this test. That gives me a story to tell. And as we've talked about before in this podcast, stories are what sell. And so if you have any of these programs that you're passionate about, the best way to extol the virtues of the program is to have some of those testimonials and real life examples that you can share. And just like we did the podcast a couple weeks ago with Victor from Zion Labs talking about the nursing home. That's a perfect example. That really drove it home about that one patient, about how we were going to treat the patient this way. We used this test, and instead we changed the treatment plan because of this, and this is how the patient benefited. Those are the stories that are going to really ring home with your physicians or any of the clients that you're dealing with. So, and the other thing that I noticed, Viv, is that the more passionate I got about things like, I mean, you've heard me talk about bladder cancer a lot now, but just because of that one time that the first time that the pathologist caught cancer, all of a sudden I became really interested in it, just naturally interested in it, and I gravitate toward information about it. And now, now granted, I'm not an expert like an MD or a researcher, but in terms of a salesperson, I would say I know more than most salespeople as it pertains to bladder cancer. So, you know, I look at myself as a leader in the sales community when it comes to bladder cancer, and there's no reason not to be proud of that. Be proud of what you're selling.
Yeah, absolutely. And I think that's a good way to put it, Mike.
Excellent. Well, with that, we will wrap up. Thank you, Viv.
Thanks, Mike.